Continue with Doctor's Eye series. Let's know about how hiccups occur. First, normal anatomy of diaphragm. Hiccups are nothing but abnormal movement of epiglottis, which occur due to rushing of diaphragm. Diaphragm made from the skeletal muscles, which actively involved in inspiration, that is, in breathing. Nerve supply of diaphragm is through the phrenic nerves. Pathological hiccups causes mainly talking during the eating, as abnormal movement of epiglottis occur. Epiglottic food unable to close the larynx. Another common cause is tachycardia or abnormal heartbeat or jerky movement of diaphragm. Common causes or acute causes includes anesthesia. Chronic is seen in peptic ulcer, gastroesophageal reflux disease, another metabolic disease like diabetic ketoacidosis. Treatment is the nasopharynx, drunk the cold water. For persistent and severe hiccups, giving sedative like diazepam and other medication.